Hey guys, I'm here with Heather. We're going to discuss our new practice of handling pharmaceutical waste. You know, your old practice of throwing it in the garbage can or throwing it in the sharps container or squirting your remaining drug into the carpet is not acceptable anymore. A particular concern that we're worried about is the effects of all these drugs, in the environment. Contaminating the water, mutating the embryonic fish and frogs and rivers, and then ultimately perhaps, getting to the people, causing, precocious puberty in all the young boys and girls. And so, due to all these concerns, we're starting to have our inspectors ask about, what are you doing with your pharmaceutical waste that's special?
What are we doing?
What are we doing? Well, I mean, in general, people try to be responsible about this. I hear about people throwing it in the sharps container, and that's it seems like a reasonable thing to do, right? It's just this technical thing of where the people who incinerate the sharps are not licensed to incinerate drugs, and so there's this obnoxious problem. I gotta tell you the truth, in full disclosure, in this case, the whole thing is there's some problems with it. It's a bit silly. I think it's a good idea in general, but we just want you to do your best.
Right.
I've got to admit that no one is on the lookout for 100% compliance with this policy.
These are our garbage.
Yeah, so the black garbage cans are going to be for drug waste. What we really don't want and can't have is any sort of biological waste in here. We can't have any sharps. It's got to be just drugs in their packaging, and that is it. There's going to be little liner baggies in here, so feel free to squirt, the remaining medication straight into here if you want. Otherwise, just the half a vial is fine.
Okay, so Kyle, what should we do about IV antibiotics?
Oh, IV antibiotics, it's just like any other drug, If for whatever reason you don't use up the whole IV, you gotta, take the rest of the bag and throw it in here. However, in most cases, you're going to be administering the whole dose, except for like the last few drops, to the patient, at which point it's considered fine. That bag with, less than like 3% left in there, or the line, it's all considered just, residual waste. There's going to be a few exceptions to this, okay? A big volume IV that's just got minerals in it, that's totally fine to go down the drain, okay? So I'm talking about saline, ringers. If it's got potassium chloride in there, that's fine. Calcium chloride, these sorts of things, that's all totally okay.
So there are some really important drugs, and their packaging apparently not to be thrown in the garbage. So we really probably should focus on the two drugs that you told me about, nicotine patches and Coumadin.
Right. So, these two drugs are especially identified as being the worst, for whatever reason, out of all of them. They consider the packaging even to be toxic. So what we're going to do is when we give you a Coumadin pill or we give you a nicotine patch, it's going to come in a little baggie. It says, special waste. And when you go to throw that one away, you're going to throw it in the same bin as everything else, but it's going to be in this little baggie, and we want you to put any like half Coumadin pill and the packaging in that baggie in the garbage can. Well, so I'm sure you're dying to know, what about narcotics?
Yes.
Okay, well, narcotics are a point of contention, in the federal government. On the one hand, the Department of Justice wants you to flush those down the toilet. On the other hand, the Environmental Protection Agency wants you to not do that, right? So in the meantime, we're going to say, well, we'll just follow our hospital policy, which is to not put it in here. It's just too obvious of a place for that to be recovered from. So you want to continue to put that into the sink or the toilet, or, we do say it's okay to squirt that into the garbage as long as it's totally non-recoverable and there's a 0% chance of anyone being able to come back after it. So that would be, a half a morphine syringe into the sharps container. There's simply no way that a person could get that out. That's fine. The last exception to all this is inhalers, those aerosol inhalers. The particular concern is that the inhalers could explode, right?
I did not know that.
Yeah, well, you can imagine they could. It's compressed gas. So the idea is that if you combine the inhalers with the rest of the hazardous drug waste, that they could explode, showering, the delivery guy with hazardous drug shrapnel, and this must be avoided. So just take those inhalers and put them in your return to pharmacy bin, wherever that might be. We'll put them in the special place in the pharmacy itself. Okay, quick review. Most of your drugs are going in these black bins now. It sounds stupid, but, Coumadin and nicotine and even the wrappers go in those little baggies in the bins. Your narcotics and plain IV solutions, those are still just going down the drain is fine. Again, whatever, the inhalers have to come back to the pharmacy so they don't blow up.
Most importantly, please know sharps, blood, or infectious waste in here. You might not realize it, but people are going to be going through it here and sorting the drugs out a little bit, so that's not fine. And also, chemo, I forgot to mention, that gets its own special bins too, so if you need to know what to do with some chemo waste, give me a call, please. And that's it.